Now, to introduce this section on walking and health, I thought it would be nice to explore for a minute why we are doing this. And George sort of alluded to some of this in his talk. But why pick walking? Certainly, the evidence is clear that physical activity is beneficial to health, and it really doesn't matter which type of physical activity you use. You get the same benefits from swimming, biking, even gardening vigorously that you would get from walking. But why did we choose walking as sort of the centerpiece of a physical activity initiative? It's been clearly proven that it has tremendous benefits for health. So we know that we are choosing an exercise which has a large evidence base behind it. Walking is the most common adult physical activity that is done. It has good long-term adherence, and we know that you can be very creative in trying to get people to increase their walking. Finally, as George again pointed out, walking is cost savings, and we can see tremendous healthcare savings by doing regular walking. So it certainly is worthy of the effort that we're putting into it.
Who thinks smoking kills more people than most of those four? Put up your hand nice and high if you think smoking kills the most. Okay. And who thinks that diabetes kills the most? Put up your hand if you think diabetes does. Now what about obesity? Put up your hand if you think obesity kills the most people. So put them nice and high. Okay, so there's a bunch of people here who think obesity. And then what about low fitness? Put up your hand if you think, okay, we're going to combine those three conditions, smoking, diabetes and obesity, into one terrible condition called smoker diabesity. Okay? So now let's play that game. Now, surely put up your hand if you think that the three conditions combined, the deaths in America from smoking, diabetes and obesity would outnumber the deaths from low fitness. That's great. Okay. But actually, low fitness kills more Americans than smoking, diabetes and obesity combined. We've got the cure for smoking, diabetes and obesity. Like smoker diabetes, it would be a terrible condition. If there was a virus that caused that, it'd be a huge public outcry. And yet it's actually existing and the treatment is in everyone's shoes.
My first story starts in the exam room with a patient named Agnes, who I've known for 22 years. She's closing in on her 80th birthday. She let me know at her last visit. She's lived in Northeast Washington all of her life. She has several of the conditions that we see every day at this medical center, including hypertension, type 2 diabetes, and arthritic knees. So at the outset of my relationship with Agnes some 22 years ago, and before the days of exercise prescriptions, I suggested to her that walking or some other form of physical activity might be a good way for her to meet some of her health goals, most specifically avoiding taking medication for diabetes. So she started walking in the early 1990s with a friend from her church, and the primary goal was to lose weight. Over the next few months, she saw that her blood pressure dropped. She saw that her blood glucose levels were improving. She also found that as she lost weight, that her arthritic knees were hurting less. She noticed that her friends were envious of her appearance and her energy level. And in addition to these benefits, which are really significant, she found, most importantly, that she absolutely loved walking. We have lots of tools available, and we're utilizing many of them. But the lesson that Agnes really brings to me is that sometimes the most powerful things that a person can do for their health are best left non-medicalized.
When I was at the obesity conference, childhood obesity conference in San Diego recently, there was a Kaiser physician that led us all in a walk, and he said that he twice a week does this thing with his patients called Walk with Your Doc, and he invites people out every Tuesday or Thursday or whatever to come and walk with him. And I thought that was just a really creative way to engage your patients and literally model, a form of exercise that could be beneficial for their health. So it's something creative that doctors could do.
Physicians who were regularly active, who walked regularly, were more likely to prescribe it to their patients. They were, in fact, more likely to prescribe preventive care to their patients. Really, in effect, they were better physicians. And so I think that's a call out to all of us. And I love what we've done. As we've done this walking campaign, Everybody Walk, we've also done KP Walk, an internal campaign, because that's where we need to start, is with our own employees, physicians. We've got to be the role models for health.